Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Dr. Danny Avula, who recently stepped down after a year of service as the vaccine coordinator for the state of Virginia. What was that job like? Let's listen. Dr. Avula, thanks so much for joining me on Public Health on Call. You were the Virginia State vaccine coordinator for the COVID pandemic.
That's right. I, prior to 2021, was serving as a local public health director in Richmond, Virginia. And January 4th, got a call from the governor's office asking me if I would run point on the vaccination rollout. And 2 days later was being introduced at the governor's press conference.
So that's a pretty big responsibility.
Absolutely. I think it's probably will be the most impactful thing I ever do in my career, but it was an incredible experience and learned a lot. And I think the team just was incredible and saved, hundreds, if not thousands of lives.
So let's dig into it. You're at the press conference with the governor. What do you do first?
Well, I think it was really understanding where were we and who was the team that was commissioned around this, what additional resources did we have to pull? And I think, bringing me in marked a shift in strategy for the state, in addition to the Virginia Department of Health, who had been navigating the entire COVID response to that point. We recognized that we were going to need expertise from all across the state agency or all across state government, and maybe even resources outside of that. And so the governor, pulled me into this role, handpicked a handful of other people from other agencies. And then we really pulled in a lot of additional boots on the ground support from consulting firm, from, again, other agencies. So it was really identifying the assets, building the team.
Sounds like you had some power to get things done within the state government.
I do think the role of vaccine coordinator at a time where this was the thing that everybody was paying attention to allowed for that, and I think the governor recognized that somebody needed to be the point person on an initiative this large. And so, I think the role that he pulled me into really did allow me to ask for whatever I needed from the breadth of state government.
So what was your first strategy?
Well, I think recognizing, where were we in terms of the vaccine that had come in? Because at that point, the vaccination effort had started the second or third week of December. Much of the vaccine in the early days went to the hospitals and health systems, both because Pfizer is what was approved. And remember at the time, we needed that ultra cold storage for Pfizer, and hospitals were the ones who had those. But a lot of people were frustrated because they didn't know who was able to get vaccine and when they were able to get vaccine. So it was recognizing or understanding what were the logistics of this. Where was the vaccine coming from? Where was it being stored? How was it being determined who would receive it? And did any of that need to change?
And did you change it? Did you find that it was easier to create a set of rules and access points for the state, or how did you go about it at that point?
We did change it, and that was a pretty difficult thing that we did early on, because at that point, the health systems had the vast majority of the vaccine coming into the state was going to them. And it made sense because the first tier of eligible people to be vaccinated were healthcare workers, and many of them were in those health systems. And so both because of the storage and because of who actually qualified, it made a ton of sense that health systems were receiving that. But that got complicated quickly because healthcare workers that were working in private offices or were not associated with a health system were struggling to figure out where do they go to get vaccinated. And so, very early on in that role, I began to shift some of that vaccine distribution to state and local health departments, and that that was an immediate friction because the health systems felt like, hey, why would you pull vaccine away from us? We're not only serving our employees, but we're really here to serve the good of all people in Virginia. I think so. That was one of the early conversations we needed to have was who was going to hold the vaccine, how are we going to distribute it, especially when it was such a scarce resource.
How did you make the case for a pretty robust public distribution of vaccine on top of or alongside the healthcare system's distribution?
Well, I think once we got beyond that 1A group, the healthcare workers, and through a parallel pathway, the federal government was sourcing vaccine directly to CVS and Walgreens. They were really, reaching out and prioritizing the long-term care facilities, assisted living facilities, and nursing homes. But as we started to get to that next tier of eligible population, we recognized that there needed to be more outlets than just the health systems. We needed to have, the public health system ramped up and ready to go to provide large-scale mass vaccination centers all across the state. And I think the public at large very much understood it, and especially when those centers were up and running, very much appreciated it. But, the health systems initially who had received much of the vaccine, doctors' offices, I had to navigate a lot of challenging relationships with our primary care infrastructure, with our outpatient infrastructure, because they were all making the case, hey, we have access to these high-risk patients who are elderly or have underlying conditions. You've got to send that vaccine through us because we're the ones who patients trust to get that. And so, again, when this was such a scarce resource, every provider wanted to get vaccine for good reasons, because they wanted to get it to their high-risk population.
So phase one, healthcare providers moved quickly after you started. Phase two, open it up, large-scale vaccine sites, continue with some health providers. Then you started to move to maybe a third phase with a lot of outreach, because around April, May, June, you went from scarcity to, more vaccines than you can deliver.
Yeah, that's exactly right. I mean, April and May were when all the vaccine was coming in. That's when we expanded our mass vaccination sites even further, just so that we could get to volume. And we had days where we were doing over 100,000 doses a day in Virginia. So it was a pretty exciting time. People were finally starting to feel that sense of relief. And for especially frontline public health workers who had just been beaten up from January to March, it was a real shift in tone because people were celebrating. It felt so good to be in those sites, and just the energy of the actual vaccination event itself, but the gratitude that thousands and thousands of people felt because they could finally get access. But it also allowed, this was the same time that we were bringing in contractors to take on some of those large-scale vaccination efforts. And that allowed the health department teams to get in their mobile vans and do even more community-based outreach, to think about, okay, what does our data look like? Where are the pockets of our community who are not vaccinated? How do we reach them? Is it just a physical presence that we need? Sometimes that was the case, but in many cases, it was actually that we needed a different messenger. And I'll give an example here in Richmond. Early on, we really struggled to vaccinate our Spanish-speaking community, even though we had community health workers. We had longstanding relationships in largely Latinx communities. But the confusion around the vaccine rollout, who was eligible, do I need this? All of that just led to a fair amount of resistance. And so it wasn't until we started to tap these grassroots organizations. The Sacred Heart Center is one here in Virginia that we said, hey, help us out, guys. We've got the vaccine. You've got the relationships and know-how. What do we do? And so they took over, and they knew that Sundays after church is a time where a lot of our Latino families had time and set aside time to do things for their family. They actually said, let's go ahead and have the vaccination events right here on the church grounds. And they called everybody in their network. And so I think the voice was important, the logistics were important, but really having an organization that had that deep, longstanding relationship with community was probably the most important thing. And that was a huge swing, because we went pretty quickly within a couple months to having higher rates of vaccination in our Latinx community than we did in some of our other subdemographics.
What was your approach to communication?
So we were really committed, and even pre-vaccination. So as a local health department, we were doing weekly press conferences. Our mayor really stepped out quickly to say, we've got to use the platform of the media to get information to our community. Many weeks I would join him. And so we had a strong traditional media presence. I was doing media almost every day. So whether that was in local news stations, local radio, and then we would do our non-English speaking, our Spanish media as well. And they would have me on regularly and translate. And so I think all of those things helped. We also really built up our web presence. I think governmental health departments are not necessarily known for their strong web and social media presence, but COVID gave us access to resources and the sort of sense of urgency needed to really prioritize those things. So we had a great web designer that we brought on, revamped our whole look and feel, and then also we're much more active on social media. We responded wherever we could, as the state vaccination coordinator. I mean, part of my early role was absolutely the operations of vaccine rollout, but it was just as much the media, the communications, and the relationships. And so, in those early days, January, February, March, I was working 18, 19 hours a day. I was doing town halls for legislators. I was doing media all over the state. And so really anyone who was willing to get the message out, I prioritized and only made time for.
A lot of health officials have faced threats, harassment in the process of doing some of the things that you're talking about, getting the word out about a vaccine that can save people's lives. And did you experience that? How hard was this for you personally?
Yeah, definitely some. I will say that after having spent most of 2020 in the Richmond market, doing media very regularly, becoming a well-known face and personality in the community, so much of the Richmond response was of gratitude and affirmation. And when I shifted over to the state response, there was a quick turn, because not only was the context different, people were so angered and afraid because they weren't sure when they were going to get access to vaccines. So it was a much more tense period. But there were also a lot of people who felt like they needed to let me know about the kind of job I was doing or what we were trying to make people do in some cases. And so, I received a fair number of pretty direct email threats, aggravations, a bunch of handwritten notes telling me to resign or expressing frustration that their taxpayer dollars were paying for my salary. And then a couple of pretty awful, sort of violent threats that I passed on to our state police. How did that feel? I think, thankfully, here in Virginia, I mean, that was so counteracted by the hordes and hordes of people who were just so grateful to finally have access to vaccine, that I think, a recognition that this is part of what politics has done in this season and what COVID, like how COVID has been politicized. And so I never really felt like, that was personal, but it was more a reflection of the heightened anxiety of the time.
So there is a lot of anxiety, and it's generated by a lot of misinformation. And particularly now we see pretty stark political divides in what people think about vaccination. How did you try to cross those divides? How did you try to counter misinformation, particular news sources? Did you have a strategy for that?
Part of the strategy was make sure that we are accessing all of the media outlets, regardless of their conservative or liberal leaning. And again, I'll give an example here in Richmond where one of our very conservative radio talk show hosts had me on a couple times a month, and he was very skeptical about the vaccination early on. He came around pretty quickly.
So your incredible year of being the vaccine coordinator for the state of Virginia has just ended. What are the key things that are going to stick in your mind?
This was an incredible team effort that ended up in almost 15 million doses being delivered in Virginia. Over 70% of our population fully vaccinated, puts us at top 10 in the country. And that we did the work to get to communities that didn't have access or connection to this. And that was a phenomenal accomplishment.
Dr. Avula, thanks so much for joining me today.
Thanks, Josh. Great to be here.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.